So joining us here today, we have Jill Hunsinger-Ryan, the Executive Director of CDPHE, Dr. Rachel Herlihy, State Epidemiologist with CDPHE, and Scott Bookman, Incident Commander for CDPHE's COVID-19 response. So with that, I'm going to go ahead and share our slide deck with you all. Is everyone able to see the slides?
Yep.
Great. Okay, so as I mentioned, we have Jill Hunsinger-Ryan, Executive Director of CDPHE, Dr. Rachel Herlihy, State Epidemiologist, and Scott Bookman, COVID-19 Incident Commander. We'll kick it off with Jill. Thank you.
All right. Thank you. Good afternoon, and I'm so glad that you could join us today. Before we get to Colorado's goals, I just want to provide a little bit of context for this press conference today. You know, summer's coming and people naturally want to get outside and interact. CDPHE has had 44 counties that have asked for variances to safer at home, and they are anxious to loosen restrictions, and we want to support them as appropriate to local conditions. Several of these have just come in the last few days, and we've approved 14 or so. But we know that local communities are anxious to reduce restrictions. And then, you know, also during May, Governor Polis has been monitoring data and loosening restrictions where it makes sense. He will do the same for June. And finally, you know, we know there are some businesses that have chosen to open up against the safer at home orders. And at CDPHE, we would really prefer to educate instead of enforce. So we feel like it's really important to discuss where we are in Colorado's epidemic. You know, in some ways we might be a victim of our own success because Coloradans' sacrifices during this stay-at-home period really did flatten the curve, and we'll show you evidence of that. But still, we are not out of the woods. We have never been here before. This is a novel virus the world has never seen. And the behavior of this virus is pretty unpredictable, and we learn more about it every day. So I think our main message is that as restrictions are relaxed, we need to go slow so we can understand how different policies, how people's behaviors impact the speed of viral transmission so that this thing doesn't get ahead of us. So I'll start with this slide about Colorado's goals. So first and foremost, and this has been really our North Star, is to slow down the spread of the virus so that we don't exceed hospital capacity and run out of really intensive care unit beds and ventilators. And this has really been our benchmark for the policies so far. But, you know, the governor would also like to see kids be able to go back to school in the fall, and I'm sure parents appreciate that goal as well. So we have to continue to suppress the virus over the summer. At the Department of Public Health and Environment, we're monitoring data daily, and really we need to prevent a second wave of COVID-19, and we really need to prevent that from happening during peak flu season. You know, we start to see cases in October, starts ramping up in November, and it can be with us through April and May, but really the peak flu season is November through March. And if we have too many flu cases that need hospitalization, that will certainly reduce our capacity to care for COVID patients. So it's another reason we need to keep the virus suppressed. Because if we don't do a good job of that, and we're not alone in terms of the state of Colorado, other states are considering this too, we'll have to return to stay at home. I mentioned the variance process. It does enable local communities to make policy based on local conditions. And we are leaving it up to them in terms of their decision to limit population mixing. What we mean by that is, do they want tourists in their communities, either from different areas of Colorado or outside the state? Some of them don't. Some of them are trying to have a local economy where they can suppress, you know, the spread because they have a few number of cases. Others are saying, yes, we need tourists for our economy. We're letting that decision happen at the local level, assuming that the virus isn't circulating widely in those communities today. So basically, the conclusion of this slide is that the more the virus is circulating, the harder it will be and the longer it will take to get back to, quote, normal. So I just want to call out really what is unique about COVID-19. I mentioned it's a novel virus. It's something we've never seen before. We all know by now it is more contagious and it is more fatal than the flu. In fact, we've had more deaths from COVID-19 than we did in our whole last flu season. And that's just in a couple of months. We know that the presentation of this disease is very predictable in individuals. You know, you have a range of, some people have no symptoms, some have mild, some have severe, and then of course some even die from this illness. We still don't know the long-term consequences, and you know, now we're seeing cases of the pediatric multi-system inflammatory syndrome around the nation and around the world. So this is a new event that has come from COVID-19 that wasn't with us just a few weeks ago that we knew about. Of course, right now we don't have treatments or vaccines, only experimental products. And the thing that is so confounding and so difficult with COVID-19 is the asymptomatic transmission that occurs. Part of that is because there's a long incubation period. So on average, there's a delay between when people are exposed on day 1 and when they show symptoms on day 5. You know, the flu, the incubation period on average is about 2 days. And so somebody becomes sick very quickly and they self-isolate because they go to bed until they feel better. They don't feel well enough to walk around. So they're really not spreading the disease, and that's different with COVID-19. And then we also know that approximately 50% of cases are asymptomatic, and people don't even know they have it. So they're not self-isolating. If they don't get a test, they're just walking around free in the world. They don't feel sick, so they don't stay home. And that's facilitating the spread and making it hard for public health to detect it and then isolate those people. There's also a lag time in detection because of the long incubation period. So, you know, people feel sick on day 5. Over the next couple days, they decide they need a test and they seek medical care. They, on average, get tested about day 8, hospitalized on day 13. So our data in public health that we use to make decisions about, you know, how much the disease is spreading and so what actions we should take, it actually lags 1 to 2 weeks. And then the final thing is that, you know, we still as a society do not understand if people who have COVID-19 have immunity or whether it lasts. So if you've had COVID-19, what does that mean in terms of your behavior and whether you can, you know, walk around free in the world or whether you can get it again and be contagious again. Next slide, please. And the part about COVID-19, we talked about how contagious it is its exponential growth. So in March, when we were first able to detect the disease in Colorado, the School of Public Health has estimated that the reproduction value, so that's also called R-naught, the average number of people that one case spreads the virus to. So we estimate that was between 3 or 4. We think during stay at home that the reproduction value was actually reduced to 1. So for every one person that had COVID, they only spread it to 1 other person. Disease does not reproduce at that rate. That's a fantastic R-naught. But of course we can't stay at home for long periods of time. So it could ramp up again to between 3 and 4. And visually what this means is one person with COVID spreads it to 3 people, they spread it to 9 people, they spread it to 27 people, they spread it to 81 people, and so on. And you could see how you get this exponential growth curve. And everybody, of course, is familiar with the term flattening the peak. And that's what we're talking about, is the peak of this curve and how quickly it ramps up. Next slide. So the Colorado School of Public Health has been helping us to estimate how many people in Colorado have had COVID-19. We know testing supplies have been in short supply because of supply chains that really haven't been able to keep up with the pandemic and worldwide demand on testing supplies. So, you know, we've tested about 23,000 people in Colorado, and that's how we've been trying to detect the virus. But School of Public Health has been able to model how many people they think actually have had it. So they're estimating 167,000 Coloradans have had COVID-19. That is 2.9% of Colorado's population. So if you think about that, we're really just still at the beginning of this epidemic. Next slide. So the graph on the left shows that 3% of Colorado's residents today have had COVID-19. That's Colorado's population is 5.76 million. 97% of Colorado residents have not been infected. And people talk about this notion of herd immunity, and we talk about it a lot in public health because we know if we get a certain number of people immunized against other types of diseases where there is a vaccine, you can have a certain percentage of the population not be immunized and still be protected because of herd immunity. Enough people have immunity against a disease, and it really reduces that reproductive rate to below 1. So what we would need, it's estimated that you would need a level of about 70% of people to have immunity, to have a level of herd immunity. So that means we need an additional 67% of people in Colorado to have had COVID-19 to, in theory, have herd immunity. But by the time that happens, you can imagine the number of deaths that we would experience. And the thing is we don't even know if it's possible to have herd immunity because we don't know whether immunity lasts, whether somebody gets COVID-19 and then they're permanently immune from it, if immunity wanes, or what level of immunity they even have. We don't know that information yet. And again, it's just an argument for really going slow as we reduce restrictions. Next slide, please. So this slide just shows how effective, and it says safer at home, my apologies, it's really the stay-at-home policy, how effective that was in bending the curve, and then of course safer at home that came after it. We really saw the number of hospitalizations decline. This chart shows the number of hospitalizations per day in Colorado. And I just want folks to notice, if you look in March, at the beginning of March when we first detected this in Colorado, how really quickly it ramped up, and it peaked on April 14th at 888 cases. Stay at home went into effect on April 27th. But this just shows how quickly this disease can spread and how quickly our hospitals can be really overwhelmed with COVID patients. Next slide. Wanted to show you this. This is similar in number of ventilators in use. And again, we were able to bend this curve. But you can see again how quickly this ramped up, peaking at the beginning of April at over 700 ventilators in use in one day. Now it's down to a little bit over 500. But again, just it illustrates the devastation that this disease can cause, and how, you know, policies lag, and it takes a little while once we put a policy in place to really see outcomes like this and to really bend the curve. Next slide. So another reason to go slow, and just want to reiterate that we are not out of the woods, because we really need some game changers with this disease. First of all, we need widespread testing capacity, and Scott Bookman, our incident commander for COVID-19, or the department is going to talk about where we are in testing, we are mostly limited by supplies at this stage. But testing is how we detect this disease in individuals. It's how they know it. It's how they get recommendations to isolate, to stay home for 14 days. And it's how public health is able to quarantine their close contacts. And this is social distancing on a personal level. Stay-at-home orders or safer at home, that's social distancing on a societal level. We want to be able to do it on a personal level so society can operate. We also need innovations in testing, like at-home test kits, which we believe are coming. If people could do at-home test kits, before they're able to go to school or work, that would be information that would be useful for them to determine, do they go to school or work? We need more accurate rapid tests. The rapid tests we have now sometimes have false negatives, but they're a great start. They're in short supply, however. And we need more sensitive tests to detect asymptomatic cases. So if somebody is asymptomatic and they haven't had a full-blown immune response, sometimes it's hard for us to detect that they've got COVID in their system, yet they can still spread it. I talked about immunity. We need a better understanding of immunity. And if there's value in immunity, that people have access to accurate antibody tests that can tell them whether or not they've had COVID, since some people don't have symptoms. Of course, antiviral medications, and we're very familiar with these in the context of flu. For example, Tamiflu, it really reduces the duration of illness and the severity of illness. That would be a game changer because people wouldn't get so sick. Remdesivir is promising. Of course, it's experimental. We still don't know its efficacy and safety. But at least we do have something out there. The federal government has given us some supplies of those that are being used on the sickest patients. And of course, vaccine is what's really needed to change this around, turn this epidemic around. COVID-19 is a retrovirus, so it's more difficult to create a vaccine. And this slide is just a reality check that we don't have all the tools we need today to control this virus. Next slide. So Colorado's strategy, we're trying to maintain social distancing at 55% or above. That's because modeling from the School of Public Health tells us it's this level where we won't exceed ICU bed capacity. Still asking older adults and those with underlying conditions to continue to stay home. People wear masks in public to protect each other. That's very important because this virus is spread by droplets. Our goal is for every county to have a community testing site so everyone has access to testing, that every county is able to detect symptomatic cases and contact trace exposures to those cases. We are building up a rapid response to outbreaks, and Dr. Herlihy will talk about that. And we're really data-driven. We've got a wonderful early warning system of metrics. We show the governor these daily. And if you would like a presentation by Dr. Herlihy and Scott Bookman on this separately, we can arrange that. We look at case doubling time, numbers of hospitalizations, ventilators and ICU bed availability, outbreaks, and people's mobility around the state. And we will show you some of that data today. Next slide. You may have seen this before. This is just the modeling data that we are looking at. You can see that a difference in 45% social distancing versus 55% social distancing really increases our ICU bed need. Well, at 55%, we're looking at close to 2,000 beds. At 45%, it ramps up over 4,000 beds. So wrapped into the 55% social distancing, it's not only people continuing to stay apart and people working from home when they can work from home, things of that nature, but it's also mask wearing, older adults staying home. We're able to detect people with symptoms and isolate them and quarantine their contacts. All of these things together we think will keep us from breaching the ICU bed capacity. Next slide. And this just shows the same thing. The dotted line In the slide on the right shows how much ICU bed demand, or I'm sorry, how much ICU bed capacity we have. Next slide. And we're still measuring the percentage of social distancing that is resulting from safer at home. And you can see some of the policies we put into place to reduce restrictions in terms of retail, personal services, offices, childcare, manufacturing. So we make decisions, they take effect on a certain date. We want to look at 3 generations of data to make decisions to see how these have impacted our social distancing percentages to make sure that we're not going too fast with our policies and that we aren't getting community spread again of the virus. Next slide. I will now turn it over to Scott Bookman. You know, testing is a major strategy in containing this disease. He's going to talk about testing, and then we'll have Dr. Herlihy talk about some of our other strategies. Scott?
Thank you, Jill. Thank you all for being here today. This map here shows the 41 community testing sites in 36 counties across Colorado. We know there are more testing sites than this, but these are really the ones that represent a partnership between the state, local public health agencies, and private partners like community health centers or hospitals who are all working together to increase access to testing for all those who need it. And really our goal is to ensure that every Coloradan has immediate access to testing when they need it through these community-based sites. We also anticipate, of course, that testing will continue to happen in doctors' offices and in hospitals, but we want to make sure that there's broad access to testing for everyone, and we will continue to update this map as more sites come online. Next slide, please. And as you know, throughout our response to this pandemic, testing has certainly been one of our greatest challenges. This is a novel virus. It requires novel testing, and it has been slow to ramp up. There have also been very significant supply chain issues that have constrained our ability to do testing. I am proud to announce that, in May, we have been testing somewhere between 3,000 and 4,500 people per day. That is a combination of tests happening at the state public health lab, in healthcare facilities, and then also at private labs such as LabCorp and Quest. Our goal is to get to 8,500 tests per day by the end of this month. And again, we are doing that in partnership with a number of different organizations. We have distributed approximately 24,000 specimen collection kits each week in May. We're really doing all that we can to get supplies rapidly out to our communities, particularly at these community testing sites, to get the specimen collection done for all those who need it. As I said, the supply chain has been a challenge previously. It is starting to open up pretty significantly. The governor has been relentless in his efforts to ensure that Colorado is at the top of the list for testing supplies. I am proud to announce that we have just gotten 10 kits from Thermo Fisher, and that provides enough extraction and detection materials to do 96,000 tests. And so we are really on our way to increase our testing capacity through those traditional methods. But we are also experimenting at the state lab with more revolutionary ways to do testing. As we have said previously, specimen collection has always been one of the main constraints here in COVID-19, and we're starting to work on self-collected nasal swabs. We're also looking into the potential to use saliva rather than nasal swabbing to do specimen collection. All of these are designed to increase access to testing for all those who need it. Next slide, and I believe that goes to Dr. Rachel Herlihy.
Great. Good morning, everyone. Thank you, Scott. So I want to spend just a couple of minutes talking about some of our epidemiologic strategies that we are using to really bend the curve of COVID-19 here in Colorado. Obviously, I think individuals have heard quite a bit about contact tracing, both here in the state and nationally. And contact tracing is really an important strategy that is within a larger disease containment strategy that includes disease investigation, so case investigation strategies, and then that's followed by contact tracing the individuals that are identified as contacts to that case. And then also in providing wraparound services, support, resources to individuals who are in isolation and quarantine. And so our primary goal here is to really try and increase our workforce that is available to do this type of work in Colorado. And so we are doing that by providing direct funding for local public health agencies for workforce enhancements. We have also been in the process of onboarding public health students here at our state health department. So 50 students that are going to be working closely with our local public health partners and our staff to do case investigation and contact tracing work and really serve as surge support to our local public health agencies that are doing this work at a local level. And part of our efforts to enhance this capacity in this workforce in the state of Colorado is a collaboration with AmeriCorps. We are working on bringing on AmeriCorps staff to really be the backbone of our contact tracing strategy here in the state, to really provide that workforce that can do this work at a larger scale here in the state. Next slide. So in addition to case investigation and contact tracing work, another key epidemiologic response strategy is outbreak response. And just so everyone is aware of the definition, an outbreak is 2 or more confirmed cases of COVID-19 in a facility or a non-household grouped with onset in a 14-day period. And so the way that we investigate outbreaks is primarily with our local public health agencies providing leadership for those investigations. Really, CDPHE takes on leadership of outbreaks when those are multi-jurisdictional or when they're occurring at state facilities, such as a state healthcare facility. Otherwise, CDPHE really provides technical assistance to our local public health partners, develops and disseminates guidance for the prevention, reporting, and response to outbreaks, and provides virtual and in-person expert site visits. And we're really doing that through a team of individuals here that is also growing, that includes experts in healthcare, infection prevention, also experts in industrial hygiene, occupational health, environmental health. And so through this work, we're providing guidance and expertise in healthcare settings, residential facilities, workplaces, manufacturer and agricultural settings, and also in corrections. Our guidance is encouraging businesses who identify 2 COVID-19 cases to temporarily close those businesses and rapidly contact public health for cleaning, mitigation, employee screening, and reopening guidance. We think that early closure of these businesses is really an important strategy to control transmission that could potentially occur following an outbreak in a workplace in particular. Next slide. So I wanted to share just a little bit of data with you about the outbreaks that we have been investigating here in the state. And so you'll see the figure on the left shows you outbreaks by the sector they are occurring in. And so you can see in light blue is corrections and law enforcement outbreaks. Making up the bulk of our outbreaks, though declining over the last several weeks, is outbreaks in senior and inpatient healthcare facilities. In light green is childcare or school type facilities. In dark green is manufacturing and construction. A pink category for other, red for retail and grocery, and in an orange, facilities that are serving people experiencing homelessness. And so as I mentioned, you can see that we have seen a declining number of outbreaks that are occurring in senior and inpatient healthcare facilities, and we really attribute that to a lot of the great work that's happening in these facilities in partnership with state and local public health to really try and protect our most vulnerable populations. The figure on the right really shows you the total number of outbreaks that have occurred in the state and then the current ongoing outbreaks in the state by week. And so you can see that as of today, we have a total of 248 outbreaks and 208 of those are ongoing. One thing that's really important to understand about these outbreaks is that, because of asymptomatic transmission, because of a long incubation period, these outbreaks too tend to go on for an extended period of time, which is part of these, and they're really resource intensive for both the facilities experiencing them as well as local and state public health. Next slide. So part of what we are doing in trying to really understand the burden of disease in the state is not just tracking this virus at the state level, but also understanding how viral transmission is occurring regionally. And this is really a guide for us to know where in the state we need to be deploying resources to serve our local public health partners and potentially to respond to outbreaks. And so this figure that's shown here is a figure that's available on our website. And it really shows you in the last 2 weeks the current incidence of disease. So the reason we focus on 2 weeks in this figure is it really is a good representation of the burden that might exist in that region or county as far as investigation work, case investigation, contact tracing work happening at the local public health agency, as well as the burden of disease that potentially would exist in the healthcare system. And so it's a nice way for us to really visualize what is occurring across Colorado and where we might be experiencing the greatest burden of disease right now. Next slide. Another way that we are tracking safer at home in Colorado and our understanding of individuals' movement in the state is by using mobility data. And this is data that is commercially available, publicly available, that can help us understand how much Coloradans are moving around the state right now. And so this particular figure is based on data that shows you how much time individuals are spending at home. And this is based on cell phone data. Again, commercially available, publicly available data. And so what you can see in this figure is starting at the beginning, so before we really get to a social distancing place or a stay-at-home order, you see the baseline level of movement of individuals. You see these peaks and valleys that are typically associated with weekends, people spending more time at home, and weekdays where people spend more time at work. And so you can see that overall the average, the orange line, increases sort of in a stepwise fashion until we get to the current day. And so what you see in that mid step is really the level of social distancing or the difference in the amount of time people were spending at home leading up to the stay-at-home order. And then this final line you see at the top is the average amount of time that people have been spending at home during stay at home, and now for the last week or two during this safer at home period. And so you can see that we certainly are seeing many more Coloradans spending time at home than pre-COVID, but we're starting to see those numbers drift down a bit as individuals are moving around the state. And so this is an important measure for us to follow over time to really understand by one method, what level of social distancing is continuing to occur in the state. Next slide. And I will turn it back to Jill.
All right, thank you. So this just shows some of the decisions that the governor is contemplating. And like I said, he's being very data-driven around this. We have been working on guidance for restaurants with input from stakeholders. And on May 25th, the governor will be making a decision around restaurants and summer camps. And then after June 1st, considering additional reductions and restrictions for safer at home. And you can see May 12th camping resumes in state parks. A note on that is that the intention about that is we want people to get out and enjoy what Colorado has to offer, especially in the spring and summer. We do ask people to please grocery shop and gas up in their own community before going to these state parks as a prevention measure so that they are not transferring the virus should they have it into other communities. And then, of course, May 25th, the governor will also make a decision on spring skiing for areas like A-Basin and other areas in the state that might want to open back up for another few weeks. And finally, I just wanted you to know as restrictions are loosened, this is really the guidance that we provide around different activities and industries, and it's based on the science of how disease spread. And so our guidance will always include these main preventative steps around social distancing, wearing masks, cleaning and disinfecting surfaces, washing hands regularly, and increasing air ventilation. And of course, we prefer outdoor activities to indoor activities. And I think we'll now take questions. We'll have Mariah facilitate that.
Yes, thank you, everyone. If you have a question and would like to raise your hand, I ask you to use the raise your hand function. So to do that, if you click on your participants icon, you'll see the little hand, and then I will let you know if you're on the line and unmuted. And in the interest of time, if you could try to keep it to one question so we can get through as many as we can in this time, that would be greatly appreciated. And we'll try to take a couple for Dr. Herlihy right here at the top. And when I call on you, if you could please say your name and media outlet, that would also be appreciated. Thank you. So Libby Gardner, I have you on the line.
Hi, I'm Libby Smith with CBS4. Some people have said that we're seeing more overdose deaths than deaths from COVID-19. How would you compare Colorado's COVID-19 deaths to other categories of deaths?
Yeah, this is Rachel Herlihy. I can take that question. I think there's actually, quite a bit we need to do to understand not just the direct impacts of this pandemic on Colorado and the US and the globe, but also the indirect impacts. And we know that there certainly are going to be health impacts that are not directly from this virus, and that is an active area of interest of ours, an area that we are investigating to really try and understand what the burden of perhaps non-virus disease might be and deaths might be in the state. And so it's something that we're continuing to look into.
Next on the line, I have Sadie Swanson. Sorry, Sadie, you should be unmuted now.
Thank you. Yes, this is Sadie Swanson with the Fort Collins Coloradoan. With Memorial Day weekend coming up and last weekend seeing so many large outdoor gatherings, do you have any plans for increased enforcement, or sounds like education is also important to you all? Do you have any plans for increases in that with this weekend coming up?
Yes, thank you. Thank you for the question. So local public health agencies and local law enforcement are doing the best that they can when they see groups that are not following the state orders or the county variants. And with the state order, we're asking groups to congregate in terms of 10 or less people. And if people congregate widely, it's just an opportunity for disease transmission to spread. And it's harder for us to use contact tracing and have an epidemiological response. And the disease can very easily get away from us. So we're asking people for the Memorial Day weekend, please stay in smaller groups. Please stay socially distanced, wear masks when you're out in public, and just help keep us all safe. If there is a large gathering in a park, for example, then people are going against the public health orders, but they're also putting their neighbors in risk. And frankly, if we don't get compliance and people sort of self-regulating their behavior to prevent the spread of COVID-19, we just all end up back in having more restrictive measures that have to be taken at the state or county level. So we want to promote the message. We're all in this together, but we're not out of the woods.
Lindsay Fent, I have you on the line.
Hi, this is Lindsay Fent with CPR News. Is CDPHE weighing the risks of isolation and loneliness among residents of long-term care facilities and its decisions to keep nursing homes isolated? And what needs to happen to start loosening those restrictions?
This is Jill. I'm happy to start. So, the folks that are in these long-term care facilities are more vulnerable, or maybe we should say the most vulnerable. And the restrictions in place that prevent visitors except in special circumstances, or that isolate people, feel badly and feel inhumane. and at the same time, they are, the safest thing that we can do. So, we promote nursing homes being able to put things into place so people don't feel isolated, and whether that's using technology to connect people with their families, or being able to receive things at the home, whether that's cards or letters or gifts, and and then going through the proper prevention measures. But facilitating types of connection is really encouraged, and it is very important that we support people while they're being isolated and while they're sick. It can be a very lonely and isolating experience. But we do not have plans to reduce those measures. They're just the best ones we have, while we're waiting for better testing to help prevent asymptomatic transmission from coming into the facility, especially through the workforce.
Thank you. Next question I have on the line, Ellis Arnold. You're on the line.
Right. Yeah. Hi, this is Ellis Arnold with Colorado Community Media. CDPHE and Governor Polis have explained that the CDC requires reporting a COVID-19 death total that includes people who died with COVID-19, but not necessarily directly due to it. My question is that the standard way that the CDC requires state health departments to report death counts for all diseases? For example, are flu deaths each year or deaths in flu epidemics reported as a count of those who died directly from the flu, as well as those for whom the flu may have contributed to the death, but they don't have the flu listed on the death certificate?
This is Rachel. I can take that question. So the way that we are tracking these deaths in two different ways, as you mentioned, is by counting deaths due to COVID-19, and that's the death certificate deaths, and that takes some time. There's some lag to get that data back. And then, as you mentioned, there are also the deaths among cases of COVID-19 that occur. And so what is unique about COVID-19 compared to other communicable diseases is that both COVID-19 deaths and cases are reportable here in the state. And influenza is a bit different because what is reportable in the state for influenza is influenza-associated hospitalizations. Every single case of influenza is not reportable in the state, and influenza deaths are not reportable in the state. Only pediatric influenza deaths would be considered reportable. But there is the same system in place. If you look at individuals who are hospitalized due to influenza, one of the things that we do track is among those influenza-associated hospitalizations, how many of those individuals then go on to die. And that is tracked in the same way. It's a individual who had a positive influenza test who was hospitalized that then subsequently died. And so there certainly are parallels with other surveillance systems that we have in place. And it is not uncommon for us to use surveillance definitions that can potentially vary slightly from death certificate coding. And that's really because our surveillance system definitions, these public health tools that we use to really monitor outbreaks and trends over time, are really built at a population level, not necessarily a patient level. And they're really meant to be simple. So they apply these black and white criteria to often gray situations, but they're a way for us to systematically collect this data in a simple and rapid fashion. And so because of that, they don't always perfectly align with death certificate data. That takes much more time and investigation and coding and review to really ultimately classify.
I think it's also fair to say that we follow all CDC protocols on this, and the way that we collect our data is standardized among states so that the data is comparable. But with regard to all data collection, including death data, that's both from death certificates or death data, as Rachel was explaining, used for surveillance, we follow all applicable laws, standards, public Board of Health rules, and there are rules and statutes that govern how we do this. And like I said, CDC protocols. So everything we do is very standardized. It's standard public health practice, and you will find the same systems in other states. And in fact, there were several diseases in Colorado that are reportable to us by statute so that we are able to monitor the disease.
Thank you. I believe Dr. Herlihy might have to jump off now, but we can take one more question for Director Hunsinger-Ryan. So thank you so much, Dr. Herlihy, for joining us here today. We really appreciate having you. So this last question is from Sam Tabachnik at the Denver Post. Sam, you're on the line.
Hi, Sam with the Denver Post. I wanted to ask about a couple weeks ago, state officials talked about the convention center and the arena in Loveland as overflow space, and that luckily we have not had to use it yet, but it was going to be maintained for a little bit in order to, just in case there is this surge. With hospitalizations continuing to go down, are these spaces going to be, are they going to stay ready throughout the entire summer into the fall for, in case there is a surge in the fall, or is there a point at which they go back to normal use?
Jill, do you want me to take this one? Yeah, so this is Scott Bookman. We are going to continue maintaining those spaces throughout the summer and into the fall so that we are prepared in case we do have a second wave. The vast majority of the work on these sites has already been done, and we want to make sure that the state of Colorado is as prepared as we can be in the event that we see an increase in cases later this year.
All right, well, that brings us right up into about 11:50 here. So that was our last question, but we really thank you all for joining us here today to go over some of this information, and we hope that it was helpful. And we will share updates on next media availabilities throughout the list, just as we shared this one. So thank you again for joining us, and have a great afternoon. Thank you.
Thanks, everybody.